So I would like to now give the floor to Mrs. Katherine Andriole and Mr. Mohannad Hussain for the first speech on artificial intelligence in practice. Thank you.
Thank you very much. I'm delighted to, I wish I were there in Atlanta, but unfortunately couldn't be, or even in Europe, that would be better. But I'm going to share with you our activity around doing a demonstration at the RSNA about artificial intelligence in practice, which wouldn't be possible without standards. I'm Kathy Andriole, and I'm at Brigham and Women's Hospital and the Mass General Brigham Data Science Office, and Mohannad Hussain is the man who makes everything work for our demonstration. So next slide, please. Can someone?
Kathy, we're having technical difficulties. Are you able to share the slides off your computer?
Absolutely. Let me share my slides. So can you see my slides?
Yes, we can.
Fantastic. All right. So what we call the IAIP demonstration is Imaging AI, Artificial Intelligence in Practice demo, which we've done. You'll hear the history about it. But let me tell you a few activities of how this got started. So the first is to consider, why do we do demonstrations? And the reason that we do them is that we can take a sort of impartial nonprofit professional society like the RSNA to act as a neutral convener for the activities that we'd like to achieve by doing a demonstration. We can break down barriers to collaboration and clearly define roles and make people stick to specifications and so on. And then we're able to organize these public events that will help us meet some milestones and drive the collaborative work. We're also able to take these demonstrations and make more visible things that are absolutely essential, but maybe not as obvious to people who don't understand. For example, standards. Things can't happen without standards. It's sort of the plumbing. And these are often unseen. So we're able to make these types of things, make interoperability visible. And the last is that we can really drive awareness and adoption of these emerging technologies. So in many ways, we will have radiologists and other clinical folk at the RSNA annual meeting who, again, don't understand standards and informatics, but will know after seeing a demo like this that they need to ask their vendors for, being able to meet standards and that these are necessary for them to do their work. The other thing that we are able to do, I'm not able to advance the slides. There we go. Is that the RSNA has had a record of successful standards demonstrations. Some of you may be old enough, I know I am, to remember the 1992 DICOM imaging standard demonstration. It was called ACR NEMA at the time, and it was a very, very successful demonstration and got people throughout the meeting to collaborate to make this demonstration happen. This was back in 1992. In 1999, the first IHE demonstrations happened at the RSNA and then subsequently at HIMSS. And we've had medical conferences all over the world that have presented IHE demonstrations. And from 2006 to the present, we've had the HIMSS Interoperability Showcase, at which the IHE is very prominent. So this is just an example of folks who participated in that very, very first DICOM demonstration. And you can see some of the slides from the RSNA at that time. And this is a slide from an IHE Connectathon. So why the IAIP, Imaging AI in Practice demo? Well, we wanted to put a blueprint together for best AI integration practices based on new technologies and the latest interoperability standards. And the motivation was, again, to show that AI technologies can be implemented not just at diagnosis, which many radiologists think that's the only point, but at many points in the imaging chain, and to demonstrate that integration standards and orchestration profiles are absolutely required to embed these into the clinical arena. We also, again, wanted it to be educational, predominantly for our attendees to the RSNA, and encourage our industry radiology collaboration and partnerships to promote the use of standards and really to give us a glimpse of what the future of radiology is going to look like with AI embedded in point of care technologies. So we wanted to tell a story, taking into account a patient and a realistic clinical scenario so that our radiologists could really relate to this particular demonstration. And so we watch the patient's clinical journey and the way the data journeys through the information technology systems. We divide our vendors into teams and they work together to tell this realistic story, some in different pots, and you'll hear more about that. And the story that we created was to involve multiple exams along a timeline based on a clinical scenario. So we wanted to have acute findings that required attention right away, as well as findings, incidental findings that needed follow-up that often fall through the cracks, and how can we use standards for these? So the scenario was a patient comes into the emergency room or the A&E department with a cough. The doctor orders a chest x-ray, and on that x-ray, we see suspected lung nodules, so the doctor orders a chest CT. There's a new suspicion on that CT that leads to ordering of a thyroid ultrasound because of findings of thyroid nodules, and these will need to be followed up over time. And what we do is engage these IT systems as this patient moves through the radiology workflow, and we engage the electronic medical record, the radiology information system, of course, the PACS, the picture archiving communication system, the AI orchestrator that Mohannad will describe, that really helps orchestrate how data is moved throughout the information technology systems, the AI models, and all the way through to reporting and follow-up. And this is just one example of the results that we had. This is showing an artificial intelligence application that looks at lung nodules and quantifies them and puts them automatically into the report for follow-up. We've also had in the past patients with stroke in this demonstration, and this is a results demonstration of how one might report stroke. These are called the aspect scores, showing at each of the vessels in the brain, quantifying areas here of where the stroke has impacted. And this will help to better manage the patient based on which vessels are impacted and which functionality the patient may be losing because of that stroke in that area. So that's a little glimpse of what we're trying to do with a realistic clinical scenario. I'm going to turn it over to Mohannad.
Thank you, Kathy. Much appreciated. If we can keep borrowing your screen, that would be highly appreciated, just because we're still having issues with getting the slides up. And of course, Kathy, I want to thank you for your leadership, because without your leadership and the rest of the RSNA task force, none of this would happen. Now, I want to expand a little bit more as to what we were doing in this demo. So Kathy's already told you that we're trying to tell a story. The story takes into account the patient's perspective of what it is they're going through, as well as the perspectives of the underlying systems. If any of you here is not familiar with the radiology workflow, this is kind of high level of a blueprint of what it is that we try to do. So we start with step number one. We have an order placer, something like an EHR or a risk system. And then that can potentially be reviewed by human, but that in step two can also be potential area for AI. So people tend to think of AI and imaging as, oh, model looks at an image and makes a prediction or something. There's actually a lot of room for AI in multiple places in the radiology workflow. So here, for example, protocol refinement that can actually be done via an AI model that can actually help the physician or the technologist decide on a better protocol. Now, the modality is actually another area for AI. A lot of modalities nowadays have artificial intelligence that help the technologists figure out if they've got good positioning, or maybe be able to capture scans at a lower radiation dose level, but then amplify the image quality using AI. So almost every step of the way here can be injected with AI being helpful. Now, once the images are captured, they go to the image server or the image manager, so that's your PACS, VNA, whatever. And then we have the concept of an AI orchestrator. Now, that concept may not necessarily appear to be super important in today's healthcare realm because most hospitals may be running 1 or 2 models, but in a few years when there's explosion of AI models out there, maybe they're running tens or hundreds of them, you're going to need something that can figure out who should be looking at what. So that's what the AI orchestrator does. It can then broker jobs to different AI models depending on logic and rules that it has. That logic and rules itself can eventually be powered by AI in the future as well. Now, the AI models or algorithms will then do their magic. They look at the images, they make predictions, diagnosis, triage, whatever, it depends on the model. So they send their AI results, and here's where the AI results IHE profile comes into play. They send that to the AI orchestrator. The AI orchestrator interprets that, and now it decides which downstream systems it needs to communicate to. So for example, it may be that the AI model realized that this exam is not normal, but it's not been read yet. So it can send a prioritization message to make sure that this exam is bumped up to the top of the radiologist's reading work list. It may also be able to make helpful measurements, which can eventually make their way into the report. So there's less work, manual work for the radiologist to do here. So all of that is communicated in steps 9 and 10. And as you can see in the image viewer in step 11, a human being can review the results of AI, accept, reject, or potentially modify to say, oh yeah, you marked this pretty close, but you didn't get it exactly right. So they update it, and then these results are sent over to the reporting system so that I can actually provide an opportunity, not only for saving the radiologist's time, but also an opportunity for being able to mine that data later, which is something that we're going to do. If you can go to the next slide, please. So the next chunk of the workflow, really you can do a lot of things. This is an example of things that we've done in the past and some of which we're still doing. So once the report is done, we actually have all the systems involved in the workflow utilizing an IHE profile called SOL, Standardized Operational Log of Events. And the idea here is you can capture discrete events with timestamps throughout the whole workflow, and then you can feed that into a dashboarding system. So you can have pretty dashboards that explain to you at a glance what's going on in your hospital. Things like, for example, are my AI models making my radiologists more efficient? What's my procedure coverage? They typically have hundreds of procedures. So maybe you have one procedure that has way too many AI models working and some procedures with no AI models doing anything. These things can also then feed into cohorting tools that basically help you potentially develop new AI models or even improve the ones you have. So here you can see the image research. You can also get pretty fancy with consent management using FHIR and other standards. So this is some of the cool stuff that we do here. Next slide, please. Just as an FYI, so this demo started in 2020. I'm trying to forget what happened in 2020, but it's very hard. Obviously, it was a weird year for everybody. So we ended up pivoting and doing this fully virtually. So the product of the demo was basically a set of 4 YouTube videos. One is an introduction that explains what it is we're setting out to do. And then 3 of them explore the different clinical scenarios or different portions of the clinical scenario. We had 16 vendors bringing to the table 25 products. And up until today, they have about 12,000 views on YouTube. Honestly, given the fact that we don't necessarily have the biggest audience for this, they have to be somewhat tech geeks. 12,000, I would say, is very, very good. Every year, we try and focus on newest, latest, and greatest in standards. So that year, we were trying to get the vendors to adopt more DICOM-SR because by default at the time, a lot of AI vendors would just do things like secondary captures and whatnot, not very interoperable formats. IHE Air had just still been a draft, but we were still trying to kind of work with it. Of course, SOL is one I mentioned, and we're also encouraging non-standards, but more like lexicons and coding systems like RAD elements. Next slide, please. 2021, we managed to get back in person, thankfully. We were all wearing masks, but that's okay. I'll take that over not being together personally. We managed to grow the demo into 22 vendors and 34 products. We did 60 plus demo runs at RSNA, had more than 300 people attend. Honestly, I was there for the entire period, and I feel like everybody that attended the demo came out completely blown away. So we may not necessarily be moving a lot of people through that booth, but the educational value people are finding at that booth, I think, is extremely valuable. Of course, we're trying to get new stuff in them to keep it interested. So at that point, AI workflow and imaging had come out, the profile. AIR had actually been ratified. And of course, we try to grow Soul more and more every year. So every year we get more vendors and more products to jump on the Soul bandwagon. Firecast made an appearance in 2021. And of course, Thread Elements, we're trying utilizing more of that. Next slide, please. Kathy and her co-conspirators, you see on the screen, managed to write a white paper based on this. So if academic white papers are your thing, please have a look at this. It's actually very informative. It summarizes a lot of the cool work that's been done here, lessons learned, and kind of look at the future of what would happen. Next slide, please. This is what it looked like in 2021. Next slide. So you can forward to one more and I'll just cover the whole thing. We're almost out of time. So in 2022, we have 19 vendors, 30 products, so almost the same size. We've divided them into 3 teams. We have new standards this year. So Air Plus is just about to come out. We're trying to work with that. Firecast, the SGU2 as well is something that we're working with. We're proud that we're moving beyond upper body imaging. So previously it was chest CT, chest X-rays, brain MRs, etc. This year we actually have a prostate MR, so that's interesting. We also have our first female patient. So one of those 3 teams actually has a female patient, and that female patient is going to have a mammogram. We've added the IHE Connectathon as a requirement, which is why we're here. We actually have a bunch of vendors testing on the Connectathon floor right now to ensure optimal interoperability. And the cool thing is we're actually going with cloud-first deployment model. Last year, we told everybody to bring their stuff on site, but this year we're actually able to get it off in the cloud. I probably have room for 1 or 2 super quick questions. If anybody has a question.
Yeah, thanks. Thanks very much. That was a very impressive presentation. Thanks to North America giving us that insight. And you know, AI is in everyone's mouth, but it's always so valuable to see that it's used in a meaningful way. But because that's the other part of the story, and we see that that has really happened. We are a bit